So I've entered the room and already washed my hands. We're now ready to begin the head-to-toe assessment. We'll start with mental status. Hi, my name is Sarah. I'll be your nurse today.
Hello.
Can you tell me your name and date of birth?
Brian, 7/21/90.
And can you tell me where we are?
Philadelphia,
And tell me the day and year.
December 6, 2020.
Good. The patient is awake, alert, and oriented ×3 and scored a 15 out of 15 on the Glasgow Coma Scale. 6 for his motor skills when he shook my hand, 4 for his eyes opening spontaneously, and 5 for his verbal speech being oriented. Next, we're going to assess his eyes. I'm going to have you focus right behind me. I'm going to check your pupil constriction.
Okay.
Next, I'm going to have you focus here as I bring it into your nose and then away from your nose. Good. And then I'm going to have you follow the pen, but don't move your head. Okay? Good. So the patient's pupils are equal, round, and reactive to light and accommodation, as well as his extraocular eye movements are intact. No nystagmuses are present. Next, we're going to assess the patient's mouth. You need a pair of gloves, a tongue depressor, and your pen light. I'm going to look inside your mouth and just take a look to make sure everything's good. Can you open up? Lift your tongue up, then over to the side, please, then over to the other side. Good. Next, I'm going to have you stick out your tongue and say, ah. Awesome. Patient's mucosa in the oral cavity is pink, moist, and well hydrated. All of the teeth are intact. No presence of lesions or ulcers, and no dental caries detected. The presence of his vagus nerve is also intact by the uvula rising at the midline. Next, we're going to listen to the patient's lung for the respiratory system check. I'm going to be listening to your lungs. Do you have any cough or shortness of breath?
No.
Or any history of asthma or other respiratory distress? I'm going to be listening to 6 places on your front, 8 on your back, and 3 on each side. Okay? And I'll just need you to take a deep breath in through your mouth every time I move my stethoscope.
Gotcha.
I'm going to have you turn around. You good?
Mm-hmm.
All right, I'm going to have you take a deep breath in. Good. All right, now I'm going to have you turn to this side and just put your arm above your head. Do you need a minute?
I'm good.
Can you take a deep breath for me? Good. Good. One more time. Good. All right, now I'm going to have you turn around. I'm going to come around. Take a deep breath. And then one more time for me. Good. Patient's lungs are cleared to auscultation anteriorly, posteriorly, laterally, bilaterally. Next, I'll take his pulse rate and rhythm, as well as his respiratory rate and rhythm. Listen for a total of 1 minute, 30 seconds for the respiratory rate, and 30 seconds for his pulse rate. the patient's respiratory rate is 17 and non-labored, and his pulse rate is 72 and normal. Next, we'll assess the cardiovascular system. I'm going to be listening to your heart sounds now, and I'll be checking 4 places in your chest 2 times, once for the presence of S1 and S2, and the next, listening with the bell for any presence of murmurs. Then we'll go ahead and we'll check your carotid arteries, and then listen to them as well. Cool. The first place we'll check is the aortic valve, which is the second intercostal space, right sternal border. Next, we'll move to the pulmonic valve, which is also the second intercostal space on the left sternal border. S1 and S2 are both present in the pulmonic as well as the aortic valve. Next, we'll move to the tricuspid, which is the fourth intercostal space on the left sternal border. S1 and S2 are also present. Then we'll move to the mitral valve, which is the fifth intercostal space at the left midclavicular line. S1 and S2 are also present. Next, we're going to be listening to the apical pulse. You'll listen for 60 seconds, 1 minute in totality, at the same space, the fifth intercostal space, left midclavicular line. Apical pulse is 72 and normal. Next, I'll palpate for the apical pulse as well. At the fifth intercostal space, left midclavicular line. Good. Apical pulse, upon palpation, no thrills or heaves are present. Next, we're going to listen for murmurs. Doing the same thing over, just with a different side of the stethoscope. I'm using the bell of the stethoscope for to check for murmurs. First, we'll start with the aortic valve at the second intercostal space, right sternal border. No murmurs present. Next, we'll move to the pulmonic valve, the second intercostal space, left sternal border. No murmurs present. Then we'll move to the tricuspid valve at the fourth intercostal space, left sternal border. No murmurs present. And then we'll listen to the mitral valve at the fifth intercostal space, left midclavicular line. No murmurs present. Next, we're going to palpate his carotid arteries, one at a time. So the patient's carotid arteries are palpable and 2+ bilaterally. Next, I'm going to listen to your carotid arteries. With the bell of my stethoscope, I'm going to have you take a deep breath in and hold it while I move down the artery. So just take a listen. Okay? Ready?
Mm-hmm.
1, 2, 3, take a deep breath. And hold it for me. Good, and you can let it out. Need a minute?
Mm-hmm. Good.
Okay,
Mm-hmm.
take a deep breath. 1, 2, 3. Good, hold it. Good. Patient's carotid arteries bilaterally are clear to auscultation and no bruits are present. Next, we're going to assess the abdominal area. So I'll have the patient lie on a bed and I'll be assessing from his right side. Move the camera so you can see it. All right, good. Upon inspection, the skin is intact, the contour is flat, there's no presence of lesions or wounds, and skin color is pink and even throughout. Next, we'll be listening to all 4 quadrants for bell sounds. With the bell, not the bell, with the diaphragm, sorry. I was going to say switch the bell. All right. We'll start at the right lower quadrant. Move to the right upper quadrant. Then the left upper quadrant. And then the left lower quadrant. Bowel sounds are present, normal, and active in all 4 quadrants. Next, we're going to palpate, starting with light palpation at the right lower quadrant. Move to the right upper quadrant, and the left upper quadrant, and then the left lower quadrant. No tenderness, no guarding, and no masses were detected upon palpation, upon light palpation. Next, we'll do the same thing with deep palpation, starting at the right lower quadrant. Moving to the right upper quadrant, over to the left upper quadrant, and then the left lower quadrant. No tenderness, no guarding, and no masses were present in all 4 quadrants upon deep palpation. Next, I'm going to palpate for his liver by hooking. Can you please take a deep breath in for me? And just let it out. Good job. The liver's edge is palpable upon inspiration. All right, next we're going to assess his peripheral vascular system. So I'll have him move over to the chair again. And I'll just lower this so you can get a better look. See his whole body for this one. First, we're going to inspect the upper extremities. Facing this one.
Yes.
So the skin is pink. The hair distribution is even throughout. Skin color is even throughout. No presence of lesions, wounds, or edema. And the temperature of the skin is warm, and dry, and that is bilaterally. Next, we'll check his capillary refills in both of his hands, from starting with all of his fingers at the same time. Good. Patient's capillary refill is under 2 seconds. And now we're going to check his radial and brachial pulse. Radial and brachial pulses are equal and even throughout and 2+ present bilaterally. Next, I'm going to have you face this way. Next, we'll move to his the lower extremities. We'll do the same thing. We're going to inspect and palpate. Let me see if I can move this so you can see your feet. Skin color is pink and even throughout bilaterally. Hair is present and equal distribution bilaterally. No presence of lesions or ulcers bilaterally, as well as no presence of edema bilaterally. Next, we are going to check the capillary refill for his toes. Capillary refill bilaterally is under 2 seconds. Next, we'll check his dorsalis pedis pulse as well as his posterior tibial pulse. Okay, now face me a little bit. Dorsalis pedis as well as posterior tibial pulses are both present and normal and equal bilaterally, and 2+. Next, we'll assess for our final assessment the musculoskeletal strength test. Good. Okay, so finally, the last assessment to do is the musculoskeletal strength test. I'm going to have the patient do a hand grasp test as well as test to strengthen his upper and lower extremities. Okay, we're going to do the hand grasp test. Can you please grab my fingers? Yes. Right there, and pull me towards you. Good. Okay, next, I'm going to have you raise your arms in a 90-degree angle, and I'm going to pull you towards me. I want you to resist me, and then I'm going to push you away, and I want you to resist me. Okay? So pull, 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 pull. Good. Now push, 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 push. Good. Awesome. And next we'll do his lower. I'm going to have you extend your leg out. We'll do it one at a time. I'm going to push down and have the patient push up and resist me. Okay. Next, I'm going to pull up and you're going to push down. Resist me, resist me, resist me, resist me. Good. We'll do the same thing on this side. Extend your leg. Can you push up? Resist me, resist me, resist me, resist me. Good, okay. And now I want you to resist me. I'm going to pull up and you're going to push down. Resist me, resist me, resist me, resist me, resist me, resist me, resist me. Good. Okay. And next, next and last, we're going to assess the patella as well as the bicep reflexes. We'll have to get a new chair for that. Can you get this one?
Oh, sure.
All right. Sit right here. Good. Take a seat for me. All right. Patient's leg should be dangling, and I don't have a reflex hammer, so I'll just be simulating with my hand. Relax for me. Okay. Good. This way. Do the same side. Okay. And then next we'll do, I'll just do it on this way. so she wants it. Good. Okay. So the patient's hand grasp strength is intact and equal bilaterally. His upper extremities and his lower extremities scored a 5 out of 5 on the muscle strength test bilaterally. And the patellar and bicep reflexes are intact and present and 2+ bilaterally. I think that's it. That is the end of the head to toe physical assessment.